Hello, good morning, good evening, everybody.
Evening.
I'm Dr. Asavari Manvikar. I would like to introduce and welcome you all to CAR Global Webinar Research Series. CAR, Council for Ayurveda Research, is an international non-profit organization based in USA with its sister chapter in India by the name of AAAF, Ayurvidya Anusandhan Abhiyan Foundation. Our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote, establish Ayurveda as an evidence-based science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you all the access to our resources. No nonprofit can operate and succeed without volunteers. So please do consider joining us as a volunteer. We can place you based on your interests and also your skills. Once again, our website is www.ayurvedaresearchusa.org. Now let me introduce our platinum sponsor, Komal Herbals. It's a company based in Pennsylvania. It is focused on the concepts of Ayurveda and the power of using healthy, natural herbals and products. Komal Herbals work hard to find premium ingredients for their formulations. For more information, go to komalherbals.com. Now, let me introduce our eminent speaker today. She is Dr. Arti Firke. She is also a classmate of mine. It's so nice to meet you, Dr. Arti. She is an associate professor in PDES College of Ayurveda and Research Center, Nigdi, Pune, Maharashtra, India. She is working as a PG guide since 2008 and PhD guide since 2021. Total 6 students and of PG as well as 3 students PhD. They are actually studying under her guidance. So total 15 students have completed MD under her supervision up till today. She received her BAMS, Bachelor for Ayurvedic Medicine and Surgery, in 1997 and MD in Swastha Vrutta, Preventive and Social Medicine in 2000 from University of Pune, India. In 2021, she received PhD in Swastha Vrutta from Maharashtra University of Health Sciences, Nashik. She has huge experience in university work. Also, she worked as UG, PG examiner in university, paper setter, paper moderator, worked as CAP in charge in MUHS theory examinations, worked as in charge IVS in MUHS theory examination, worked as observer in MUHS theory examination. She has huge experience. She is working as NABH and NAAC coordinator in her institute. She has authored several papers and articles in health journals. She has also published several books. Ayurvedic Principles of Diet and Nutrition, published in Ayu World Ayurveda Congress in 2012. Textbook of Swastha Vrutta, published in 2012. Ebook published on Ayurveda. For you website, Diet and Nutrition. Ayurvedic Pathya app also is developed by her. Textbook of Swastha Vrutta, Part 1 and Part 2 is published in 2016. I welcome you, Dr. Arti. Now the floor is all yours.
Thank you, Dr. Asavari. Can I share my PPT?
Sure, absolutely.
Is it visible?
Yes, it is.
Thank you, Dr. Asavari, for welcoming me. And thanks to Council of Ayurveda Research and Ayurveda Anusandhan Abhiyan for giving me this opportunity to present my research work. Today, I'm going to present my PhD research work. So without wasting time, let's start my presentation. Just a minute. Work is assessment of Kushmanda Kalpa as dietary supplement in malnourished children. Actually, malnutrition is my topic of interest, so I decided to work on this topic during my PhD. Kushmanda means Benincasa hispida. It is Latin name. It is also called as ash gourd, wax gourd, winter melon, or I think white pumpkin. It is native plant from Southeast Asia, but I think it is also available in Japan and some parts of US and UK also. We know, as we all know, that malnutrition is the most prevalent condition affecting the health of children. It is like an iceberg. But most people in the developing countries living under the burden of malnutrition. Actually, it has two forms: undernutrition and overnutrition. And this study was carried out on undernutrition aspect in malnutrition. Undernutrition is a state in which there is deficient eating, deprived absorption, or excessive loss of nutrient. And overnutrition is produced by extreme intake of specific nutrients, which may cause overweight, obesity, and diet-related non-communicable diseases. Undernutrition has these four types: underweight, stunting, wasting, and micronutrients deficiency. I work on underweight type. We know the main reasons of undernutrition in India, in mostly India. These are like inadequate dietary intake, lack of purchasing power of the family, or lack of care during pregnancy and infancy, or unawareness about nutritional needs, or premature termination of breastfeeding, late supplementary feeding, illiteracy, infections, and poverty often lead to an insufficient diet, resulting in undernutrition. If we see the statistical data of underweight children, the situation is alarming. Percentage of underweight children is increased as per latest National Family Health Survey. This is the condition of Maharashtra. As per National Family Health Survey 5, percentage of underweight children is 36.1, and it was 36% as per National Family Health Survey 4. In India also, percentage of underweight children in urban area is still 27.3%, and in rural area it is still 33.8%. And as I work in Pune district, so I also calculate the percentage. It is 32.7% as per latest survey. Undernutrition causes very serious effects on children. Nutrition deficient children are more likely to have infectious diseases such as pneumonia, tuberculosis, which lead to a higher mortality rate in children. Undernutrition has also huge effect on social, economic, industrial, and other developments by weakening the physical and mental skill. So nutrition protection and promotion activities are very much important to our country. Government also given high priority to this activity. In Ayurveda, as per Charak Samhita, Krusha person described under Ashto Nindita Purusha, along with Stula person, that is over obese and over lean person. These are describing under Ashto Nindit Purush. Bhav Prakash also devoted a separate chapter on Karsha. And if the signs and symptoms of Karsha and undernutrition are put side by side, it is seen that they are similar. In this view, Ayurveda has certainly some solutions. In Ayurveda Samhita, many ahar dravya, food items or food recipes are described, which may be useful in undernourished children with reference to weight gain. And as per review of Samhita, it is found that in Shaka Varga, Kushmanda phala, that is ash gourd, Benincasa hispida, it is recommended as Bruhan, Balya and Dhatu Pushtikar, means it is nutritious. It can be used for weight gaining as per review of Samhita. As Nigantu Ratnakar says, Kushmandaka phalam rushyam pushtikruta dhatu vardhakam basti shuddhikaram balyam atiswadu cha shitalam. Hence, the present study was planned to assess the importance of Kushmanda as dietary supplement for undernourished children with special reference to weight gain. And Kushmanda is already used in as vegetable in many families. Some people prepare its halwa, or some families prepare its kohra vadi, Kushmanda vadi, or in Karnataka, I think it is also used as in different recipes. But Kushmanda Kalpa is not mentioned in any Samhita, but it is used practically by many Vaidyas in the regular practice in Maharashtra. So it was taken for study as it has Ruddha Vaidya Parampara. Criteria for selection of the drug: it is easily available, easy manufacturing, Kushmanda Kalpa. It is palatable, it is easy to administer, it is cost effective, and most importantly, it is unexplored by previous research worker. Primary objectives of my study: to assess the role of Kushmanda Kalpa in malnourished children with special reference to underweight, and to evaluate the comparative effect of Kushmanda Kalpa with control group. Secondary objectives are to assess the Dhatu Pushtikar karma of Kushmanda and imparting nutrition education in mothers by the way of group discussion to give comparatively cheap and easily available Aharya Kalpana in malnourished children, and to study adverse effects, if any. My research question was, is Kushmanda Kalpa 10 grams per day at Rasayankal for 3 months effective as dietary supplement in malnourished children than regular standard diet group? Null hypothesis is Kushmanda Kalpa 10 grams per day at Rasayankal for 3 months is not effective as dietary supplement in malnourished children than regular standard diet group. And alternative hypothesis is Kushmanda Kalpa 10 grams per day at Rasayankal for 3 months is effective as dietary supplement in malnourished children than regular standard diet group. Study design: an open label controlled clinical study. It is open label study. Patient also knows, and myself, I know already. And it is controlled study as it has control group. This is my plan of work. Study was conducted in these 4 steps. First step is conceptual study. Review of literature on Kushmanda, Karsha, malnutrition was taken from all the classical and modern literature, journals, websites till date. And in pharmaceutical study, authentication of Kushmanda was done from government authorized research lab, and standardization of Kushmanda Kalpa was done from authentic research lab as per API guideline. And clinical study was conducted in Anganwadi as per protocol. And before that, ethical clearance was obtained from the institution ethics committee. And fourth step was statistical study. Statistical analysis was done using proper statistical test. These are the certificates of authentication and analytical report of Kushmanda Kalpa. The review of literature was taken in 4 parts: previous work done, drug review, review of malnutrition, and review of Karsha. Actually, so far, no specific work has been done on the mentioned subject. Various research works have done on Kushmanda in Mutrashmari, means renal calculus, or mental disorders, or in Amla Pitta. Also, it's Medhya effect, that is memory improving power. But no research has been done on Bruhan and Balya Karma of Kushmanda. So this study was carried out. Entire review of Dravya Kushmanda has been taken from Vedic era till date. All review of Sharkara and malnutrition is also taken from various sources. As I told, undernutrition has 3 types, mainly 3 types: wasting, stunting, and underweight. Wasting means low weight for height, stunting means low height for age, and underweight means low weight for age. And this study was carried out in underweight children, means who have low weight for age. This is the classification of all above 3 types, and my research work was carried out in MUW, means moderate underweight children. This chart is available in all Anganwadis. Anganwadis means child health care, which are established by government for child care or for improving the child nutrition. Materials were moderate underweight children aged 2 to 5 years, drug Kushmanda Kalpa, digital weighing machine, height scale, measuring tape, vernier caliper, skin fold caliper. These instruments were used for this criteria: skin fold caliper and vernier caliper for Anguli Praman. Sample size calculation was done by following pilot study. Sample size calculated using WinPepi software. After doing pilot study, SD difference drawn and considering significance level 5% and power 80%, and considering 3 months duration, taken 10% dropout rate, and sample size is calculated by software. It was 50. And as PCMC area data of underweight children is not available, pilot study was done to draw the sample size. Study was conducted at various Anganwadis of corporation. As I told, Anganwadi is a type of child care center in India, started by government in 1975 under ICDS program to combat the malnutrition. It provides basic healthcare activities, which include nutrition, education, and supplementation. And I work in PCMC area, that is in Nigri area, and there are 24 Anganwadi in Nigri area. And the selection of Anganwadi was done randomly by lottery method. Then children were selected from randomly selected Anganwadis. My target population, as I told, MUW children. Sampling technique was purposive sampling. It is a technique in which researcher relies on its own judgment when choosing samples of populations to participate in the study. It is used when we want to access a particular subset of people, and I rely on growth chart of ICDS and selected MUW children as per ICDS chart criteria. So it is a purposive sampling. Inclusion criteria: moderately underweight children as per ICDS program guideline, WHO, and age group 2 to 5 years irrespective of sex and religion. Exclusion criteria: severe underweight children and children suffering from another serious systemic disease and congenital disorders. Permission from local authority, that is CDPO, Child Development Program Officer is there in corporation. I have taken permission from him before conducting clinical trials in Anganwadi. Total 100 moderate underweight children were selected from various Anganwadi centers of PCMC for the study. Grades of undernutrition were decided by weight for age criteria. Age of child was obtained from the date of birth mentioned in Anganwadi register by Anganwadi Sevika. Grade of undernutrition was decided by plotting age and weight readings on growth chart provided by ICDS, that is Integrated Child Development Services. This is the growth chart which is used in Anganwadi under ICDS for growth assessment. There are separate charts for girls and boys. Pink border chart for girls and blue border for boys. A growth curve is formed by connecting the plotted points on the growth chart, and there are 3 printed growth curves. These are which are named reference lines or Z-score lines, and these are used for understanding the growth pattern. We can get grade easily by putting child age on horizontal line and child weight on vertical line, and then after joining the both points, if it falls in yellow, it is moderate underweight, and if it falls under red, it is severe underweight, and if it falls in green color, it is normal healthy child. And as per this growth chart, I have selected undernourished, moderate underweight children. Children were divided in 2 groups. Group A, that is trial group. 50 children were selected and they were received Kushmanda Kalpa with regular supplementary diet. And group B, control group, 50 children were received regular supplementary diet without Kushmanda Kalpa. Along with this diet, government also supplies, actually this is a weekly diet which is provided by government. Government supplied this diet for weekdays, like rice dal khichdi or green peas pulao or shira, upma. And along with this diet, government also supplies fortified food packets of upma, shira, dalia, shevaya, etc. to the children. Route of administration of Kushmanda Kalpa was oral, dose 10 gram per day, Anupan water, Kal at morning, duration for 3 months, and follow-up was taken after every 1 month. Anganwadi Sevika had given Kushmanda Kalpa to children. I was visited daily to Anganwadi. Also gave Anganwadi Sevika 5 gram spoons and packets of 100 gram. And even some parents, whenever they had gone out of Pune, they collected packets from me because children were liking it. It is sweet in taste and it is palatable. Follow-up was taken at interval of 1 month for a period of 3 months. That is 0, 30, 60 and 90 days. Deworming was done in children before starting trial, and informed written consent was obtained from every parent of child before including in trial. As work had done in Anganwadi of local corporation, deworming of children was done there with regular basis, actually. Group discussion, all mothers were educated regarding diet importance and its role in growth of their child through imparting health education in various group discussions. Actually, at the time of enrollment, mothers' counseling was done for diet importance. not given specific protocol of diet, but told them the importance of proper balanced food eating. Also tried to convince them to avoid repeated eating of Maggie or ice candy or cream biscuit, fast food. It's more challenging rather than giving Kushmanda Kalpa, as all children were from poor socio-economic background and there is lack of basic health education. 3 children were dropped out due to irregular attendance, not following the instruction. This is Kushmanda Kalpa, which I have used for my study. This is SOP of Kushmanda Kalpa. Fleshy part of Kushmanda Kalpa was used for preparing the Kushmanda Kalpa. These are assessment criteria. Body weight, height, chest circumference, head circumference, mid-arm circumference, skin fold thickness, and Anguli Praman Pariksha. These standard anthropometric parameters were taken for the study, as these are the indicators of nutritional status and reflect the pattern of growth development. These are the operational definitions. Chest circumference I have taken at the level of nipples, or head circumference from occipital protuberance to supraorbital ridges. Mid-arm, mid-upper arm circumference between the tip of acromion process of scapula and olecranon of ulna, and skin fold measurement taken at tricep area. Anguli Pariksha, actually it is a unique measurement parameter of Ayurveda, and vernier caliper was used for taking Anguli Praman measurement. For that, hand was kept on the flat surface and vernier caliper was held perpendicular to the long axis of the finger, and measurement was taken by noticing which division of vernier scale coincide with the division of main scale. And after taking single Anguli Praman measurements were evaluated from 3 different sides: head, chest, and mid-arm. That is head Anguli Praman, chest Anguli Praman, and mid-arm Anguli Praman. Example, if Anguli Praman is of child is 1.20 and chest circumference is 46 centimeter, then chest Anguli Praman 46 divided by 1.20 equal to 38.33. These are the subjective parameters. Kasa Daurbalya, Kas Kapha, Daurbalya weakness, Pratishay common cold, Kshuddha appetite, Nidra sleep, Malavashtamba constipation, Pandota pallor, Tvak sparsha, skin texture, and appearance of child. These subjective criteria were taken as per reference of Bhav Prakash and Sushrut, and during pilot study, these symptoms observed prominently in the children. And also Kasa, Daurbalya, Malavashtamba, Nidranash are stated Upadrav of Karsha in Bhav Prakash and Nigantu. These parameters were assessed by giving appropriate grading. These are the gradation for all subjective criteria. These statistical tests are used for analysis. For quantitative data, parametric tests are applied. For before and after treatment paired t-test, for comparison of A and group unpaired t-test, and for follow-up repeated measures ANOVA test. And for subjective data, as it is ordinary data, non-parametric tests are applied, like Wilcoxon sign rank test is applied for before and after treatment. For comparison, Mann-Whitney test is applied, and for follow-up, Friedman test is applied. These are the observations in objective criteria. In body weight, height, mid-arm circumference, chest Anguli Praman, and mid-arm Anguli Praman, p-value is less than 0.05. So it is found significant result in group A, and in group B, significant result found in body weight only. In follow-wise result, after applying repeated measures ANOVA, it is found that significant results are found in body weight, height, chest circumference, mid-arm circumference, chest anguli praman, and mid-arm anguli praman in group A, and in group B, significant result found in body weight only. Notable thing is that chest circumference is not significant in before and after treatment result, but found significant in follow-wise results. But it is not clinically significant actually, hardly 1 centimeter increase in 6 children. So it is not clinically significant. If we compare between group A and group B, significant difference in body weight, significant difference observed in group A and group B. Mean difference for group A is greater than group B. Hence, the effect observed in group A is more than group B. Also in height and skin fold thickness and head circumference, p-value is greater than 0.05. So it is concluded that there is no significant difference observed in group A and group B. In chest circumference and mid-arm circumference, p-value is less than 0.05 and mean difference for group A is greater than group B. So effect observed in group A is more than group B. Same in chest anguli praman and mid-arm anguli praman. Effect observed in group A is more than group B. But in head anguli praman, as p-value is greater than 0.05, there is no significant difference observed in group A and group B. These are the before and after treatment results of subjective criteria. Significant results are found in group A in all criteria, and in group B, significant results are found in weakness and in pallor. In these two criteria only. These are before and after treatment results. These are follow-wise results. While comparing, it is observed that p-values of all. While comparing, it is observed that p-values of all parameters are less than 0.05. So it is concluded that there is significant difference between group A and group B. Mean rank of group A is greater than group B. So it is concluded that effect observed in group A is more than group B. While taking the review of drug, it is observed that in Sahita Kal, Charkacharya and Sushrutacharya describe Pakva Kushmanda, that is matured Kushmanda, Tridoshara. Also, Acharya Vagbhat described the Kushmanda as the best among the creepers. Many Kushmanda Kalpa like Kushmanda Rasanyo, Kushmanda Avaleha, Kushmanda Kalyan Gudo, Khanda Kushmanda. These are described in various Sahitas. And as per Nigantu, most of the authors mention Kushmanda having Madhur Ras, Madhur Vipak, Shita, Virya, Laghu and Snigdha. Nigantu Ratnakar clearly mentioned that Kushmanda is Pushtikar, Dhatu Vardak and Balya. Bhav Prakash also stated Kushmanda as Bruhan. And also Priya Nigantu and Raj Nigantu states properties of Kushmanda as Bruhan and Rushya. A review of Karsha was taken from various aspects. In Ayurvedic texts, Karsha is described in different ways by each Acharya. Karsha is not described as separate disease. Charak described Karsha person under Ashtonindi, as I told before. And by taking review, it can say that nutritional deficiency disorder in children can be classified into groups. Mild moderate form means Karsha and severe form means Parigarbhika, Balashosh and Ati Karsha. Group A results were more significant than Group B. Significant result found specifically in increasing body weight. This is the probable mode of action of Kushmanda Kalpa in weight gain. Kushmanda Kalpa acts as balya or bruhan by its madhur ras, madhur vipak, shita virya, snigdha guna, dhatu vardhan karma, and increases weight. As we know, madhur ras is made up of two fundamental elements, that is Prithvi and Ambu, which is equivalent to property of Maunsa, and it has ability to rebuild the dhatus, pacifies vitiated vata, and gives stability to body. Madhur ras also increases strength of 7 dhatus by its Guru, Shita, Snigdha Guna, and acts as Rasadhatu Tarpan and Bruhan. Snigdha Guna hydrates all muscles as Kledane Snigdaha, and it increases Bala. Madhur Vipak also helps for Bruhan Karma, specifically Maunsavardhan. Bruhanam, as we know, Bruhanam, Maunsavardhanam. And Shita Virya gives Prinan to all dhatus and acts as Balya, and also diminish Vata dosh and Vatanuloman property of Kushmanda and Lagu Guna helps in maintenance and balancing of Agni and ultimately causes proper digestion of food. So weight gain seen more significantly in group A. We know the principle Sarvada Sarva Bhavanam Samanyam Ruddhi Karanam. According to this principle, we can say that intake of this Kushmanda Kalpa provides nourishment to Rasa Raktadi Dhatu, and by elevation of Vata dosh, Karsha is treated. Significant results are not observed in skin fold thickness, chest circumference, head circumference, and head anguli praman. Might be due to inadequate duration, maybe long duration trials necessary. Kushmanda Kalpa seen effective in following qualitative criteria in group A, that is Kas, Daurbalya, Pratishayak, Kshudha, Nidra, Malavashtamba, Panduta, Tvaksparsha, and appearance. All these lakshana are seen due to dhatukshay, that is due to catabolic action, and Kushmanda Kalpa acts by its anabolic action, by its rasa, virya, vipak, and gunas, as seen in the last slide. Here, Samprapti Bhanga can be seen of Karsha due to Hetu 7, that is Rukshanna 7 or Pramitashan. There is Vata Prakop by its Agnidushti, or Agnidushti may lead to Vata Prakop, and due to this formation of Ama occurs and it depreciates nourishing Rasadhatu. So Rasadhatu fail to nourish tissues. So due to insufficiency, it adversely affects the circulation of Rasadhatu in the body, and this hamper proper nourishment of remaining dhatu, which lead to dhatukshay and ultimately manifest as karsha. And Kushmanda Kalpa is useful to break this samprapti. By its rasa, virya, vipak, it decreases vata, and by its laghu and deepen property, it increases kshudha, and proper nourishment of rasadhatu, and it acts as dhatu vardak and balya. And as Charkacharya said, Krushanam Bruhanartham cha Lagu Santarpanam cha Yat. Lagu and Santarpan dravyas are beneficial for Bruhan Karma. So Kushmanda Kalpa is useful in Karsha. Here I would like to cover new perspective as per modern science. Type 1 nutrients and type 2 nutrients. Type 1 nutrients deficiency can be seen with signs and symptoms. Example, iron, folic acid, iodine, calcium, vitamin deficiency. And type 2 nutrients deficiency cannot be seen, but it affects on linear growth and appetite of child. Example, zinc, magnesium, potassium, phosphorus, sodium deficiency. And type 2 deficiency affects the growth of child. And in undernutrition, both type deficiencies are observed. And Kushmanda fruits are source of micronutrients like phosphorus, calcium, iron, potassium, zinc, iodine, copper, fluorine. It contains nearly 20 milligram phosphorus, then calcium 30 milligram, 111 milligram potassium, then 6 milligram sodium. So it is also good source of soluble fiber. So it helps for the growth of children. So conclusion of my study, Kushmanda Kalpa 10 gram per day at Rasayan Kal for 3 months is effective as dietary supplement in malnourished children, specifically in underweight children than regular standard diet group. It is finally concluded that the therapy used in the trial group, that is Kushmanda Kalpa, is more effective to increase weight as compared to regular standard diet group. Kushmanda is found effective as Dhatu Pushtika, specifically on Mansa Dhatu. No any adverse effects are observed. So H0 is rejected and H1 is accepted. Scope of further studies. Similar study can be taken in any age for weight gain, and similar study can be taken with large sample size and for longer duration. Thank you.
Thank you so much, Dr. Arti. It was amazing. Great presentation and very informative. There was a
Thank
lot
you.
of clarity about all the work that you have done for your PhD. It was very useful.
Thank you, Dr. Asawari.
Does anybody have any question for Dr. Arti?
Can I share my view? Madam?
Yes, sir.
I am Vaidya Patentkar from Mumbai, practicing for last 34 years. I had one patient, as Madam has indicated, age-related weight gain. So the patient was working with MTNL as an optic fiber engineer, and he was having hemoptysis for at least 6 to 8 months. And for that, he was on AKT for last 6 months, but no improvement. Weight loss was there, everything was there. So I prepared myself Kushmanda Leha and given him 15 gram per day at Rasayan Kal. And it was like a magic. Within 4 months, he has totally relieved by his hemoptysis, and the weight gain after 6 months was 3 kg.
Excellent, sir.
So that was experience. And so after that, I am preparing myself Kushmanda layer. And as told by Madam, in cough conditions and in weight gain, and as a Agni Vardhan also, I used
Yes,
in
sir.
so many patients. Thank you,
Yes,
thank you,
sir.
Madam. And it was a
Yes.
nice presentation. Thank you.
Thank you, sir. Thank you, sir.
Dr. Arti,
Yes, sir.
what is the main obstacle in treatment or eradication of malnutrition in children?
Can you repeat your question, sir?
What is the main obstacle in the society for eradication of malnutrition in children?
Okay. Actually, to convince the parent for taking proper diet,
Okay.
as there is a lack of education, lack of knowledge regarding nutrition, then they don't know the importance of diet, or they don't know regarding nutrients, vitamins, as all children were from poor socio-economic group. So
Right.
it was very tough for me to convince them to avoid Maggie or other fast food. So it is more problematic.
So how do you convince?
I have taken some counseling sessions, and in a group discussion, I have tried to convince them.
Okay.
Hmm.
And what is the main difference in the treatment of malnutrition in children in Ayurveda or modern medicine that is called allopathic medicine?
Mm. Actually, mainly it depends on diet, sir. For SAM, if there is severe malnourished child, there is a treatment as per WHO guidelines. But I didn't work on SAM criteria, that was very severe undernourished children. I work on moderate underweight children, and they can be cured by taking proper diet.
Thank you, Dr. Arti.
Thank you, sir.
Anybody has any other questions? It was amazing work, Dr. Arti, and especially educating parents is, one of the part of this work, which is very, very important. It's not just giving the Kalpa and finding the results of it.
Yes.
It's really commendable.
Thank you, Dr. Asawari, for giving me this opportunity to present my work. Thank you very much.
It's my pleasure. Thank you, everybody, for listening and for joining our webinar. This recording will be available on our YouTube channel for Ayurveda Research, USA.org. So you can go to our YouTube channel. You can see this, as well as there are some other webinars recordings also. So you can like and you can share. You can also participate. I would love to have you attend other webinars as well. Thank you so much, everybody.
Thank you.
Thank you. Bye.
Bye.
Okay, bye.